Good afternoon, everyone. This is Saro Arakinas, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive daily notifications on medication news and updates. So, what is JIVI? JIVI, antihemophilic factor, is a I've included the various dosages, images of JIVI over here. Is a recombinant DNA-derived factor 8 concentrate indicated for the use in previously treated adults and pediatric patients 7 years and older, with hemophilia A, which is congenital factor 8 deficiency. It's for on-demand treatment and control of bleeding episodes, perioperative management of bleeding, and routine prophylaxis to reduce the frequency of the bleeding episodes. So again, JIVI is a anti-hemophilic factor 8 for 7 years old and older patients, pediatric and adults, for perioperative management of bleeding, on-demand treatment and control of bleeding in hemophilia patients, especially in hemophilia patients. The recommended initial dosage regimen is 30 to 40 international units per kilogram, as you see over here, twice weekly. For children, the recommended initial dose is 60 international units per kilogram twice weekly. JIVI is available in lyophilized powder in single-dose vials containing nominally 500, 1,000, 2,000, 3,000, and 4,000 international units, as you see in the image over here, in different colors of labeled vials. Do not use in patients who have a history of hypersensitivity reactions to the active ingredients or substances in JIVI or polyethylene glycol or PEG. They have in those patients allergic to mouse or hamster proteins or other constituents of the products. Again, these are mainly for those patients that know there is a specific hypersensitivity reaction and actually a major reaction previously that they have experienced. Most common side effects seen from JIVI include headache, fever, cough, and abdominal pain. Again, this is JIVI information, anti-hemophilic factor 8 for patients 7 and older with hemophilia. Also on-demand treatment and control of bleeding episodes, perioperative management of bleeding, and routine prophylaxis to reduce the frequency of bleeding episodes. For more detailed information on JIVI, refer back to the package insert, which will give you more information on the dosing, cautions, and precautions for JIVI. Or you can also comment on the video with your questions, and I'll be happy to answer any questions you may have on JIVI. Hope you enjoyed this video. As always, stay safe and take your medications.